These restrictions will be adjusted subject to conditions on the ground. There will be exemptions for Americans who have undergone appropriate screenings, and these prohibitions will not only apply to the tremendous amount of trade and cargo, but various other things as we get approval.
President Trump announcing the sweeping travel ban from Europe last night, hoping to stop the spread of the coronavirus, but he made a mistake there. When he talked about cargo, he meant people coming from Europe. Welcome back to Rip. With us right now is a man who spent 20 years treating patients in the emergency room and now teaches a new generation of physicians to handle the most difficult medical challenges. Dr. Adam Rosh is here. Next to him, Abram Wagner, a brilliant researcher who has studied this virus to determine how it infects us, how it spreads, and hopefully how to kill it. Also with us, Dr. Michael Busito, surgeon, medical school professor, and a member of the Wayne State Board of Governors, plus the local reporter who travels the world reporting the news and trends that matter to us here at home, Paul Eisenstein of the DetroitBureau.com. And of course, everybody knows Charlie. So, Dr. Rosh, let's begin with you because you are on the front lines in the ER where so many patients come if they're feeling sick. So if somebody comes to you with a high fever of 104, coughing, what do you do?
So, you know, one of the main issues of why this is so unknown and how we are handling this is because testing right now is not available universally, and testing in the locations that it is available, it just started a week ago. The restrictions to testing are also stringent right now. So one of the main things that we could be doing for anyone who is out there is that we could increase testing in emergency departments, both with patients and within the public, in order for us to truly get a grasp of how widespread this is and how endemic it is in our society right now. We need to start testing people. That's where I'd start.
Meanwhile, Abram, we spoke to you about a month ago as this virus was growing in Wuhan. Now it's all over the world. Is it impossible to stop? How big can this get? How big will it get?
So fortunately, we've had some really good examples from other countries which have been successful at controlling this, like Singapore, Taiwan, even South Korea to an extent. But we've seen some really bad examples like Italy and Iran. So I think we know what to do to control this disease, but I'm not going to sugarcoat it. It's going to get worse before it gets better. Right now, we're seeing a slight uptick in cases here in Michigan and across the United States. It's going to go up. But right now, we have a choice. Do we want it to go up really quickly, and then of course it'll go down, or do we want to slow the spread and compress how fast this is spreading? And we call that flattening the curve, because instead of it going up so quickly, what's going to happen is it's going to go up just slightly, but then maybe it'll last here in the United States a bit longer. But frankly, that's going to be the better option, because if we're able to slow the spread of disease, then that means that our health system is not going to get overwhelmed. That means that doctors aren't going to need to be turning people away for hospitalization or at the ICU. So what does this mean? This means that as long as we are socially distancing ourselves, you know, not shaking people's hands, ask your boss if you can work from home. I think that's the take-home message for anyone here that's listening to this tonight. If you don't have a plan at your work for you to work at home, ask if you can. And certainly there are people who work hourly positions in retail, restaurants, they can't have that. So for the rest of us who can work from home, we really should be. But as for how long this is going to last, really this is up to what are the individual behaviors that we are going to take today. And certainly this could affect the majority of Americans.
The majority of Americans?
That is
there
what some of the estimates
60 million people here.
But that's how viruses like this spread. But what we want to do is spread that over a longer period of time. Because think of that. If we have this right all at once, that would be a disaster.
Well, you talk about the behavior of individuals. I know that several universities, I think Wayne State may be among them, they've decided to go to online instruction instead of person-to-person classroom instruction. But I saw last night in Ann Arbor, after the U of M decided that they would cancel classes, these kids weren't going home. They were lined up outside of a bar. They were congregating in large groups, exactly what we told them not to do. So how do you stop that? How do you stop that?
Well, I think if you look at Wayne State, our population is different. Most of our kids are working, they're commuting, and I don't think that they're living the dormitory lifestyle so they can go to the bars at night. So I don't think that's going to be a problem with us.
But The question is, though, is behavior. I think young people, maybe incorrectly, have the belief that they are immune or invulnerable. Yes, most of the deaths have occurred in the elderly, but young people can still get sick, right?
Yeah, Huel, this is not going to be solved by a Michigan State student or a Wayne State student. This is not going to be solved by an elderly person in California. This is going to be solved by the entire country, and each one of us needs to take the responsibility. We could use the word socially distance ourselves, or we could use the phrase physically distance ourselves, which I think is a much better phrase to use here. It's not about being able to not speak with our loved ones or our friends, or maybe going out and getting some bread from the store. It's about maintaining physical distance, being smart about touching our face, washing our hands, using common sense measures. But this is not solved. The government's not solving this. The people will solve this, and I have faith that the people will solve this. And the important thing here is what we do this minute, this hour, today, and tomorrow is going to impact whether or not we're dealing with this for the next week, 2 weeks, 2 months, or 2 years.
Meanwhile, the financial impact has been enormous.
Yeah, if I can, I want to toss out two things. One of the biggest problems out there is not knowing what the realities of this are, not having a clear message. One of the biggest problems we've had right from the top, including last night with the president, has been a very confused message. And even the folks who were on with you in the first segment, there was some information that I think we need to discuss. For example, they were saying 30, 60, 90 days. We talked a little while ago. The Spanish flu, which killed 50 million people worldwide, went on for 2 years. This could last. Am I right? I'm not the doctor.
It was in 1918, though.
Yeah. Anyone who will give you a number of how long this will last is misinformed. We do not know how long this will last. What we do know is the sooner we take proper action, the faster this will resolve. The key question here is at what cost?
Right.
Okay.
How much do we shut down?
This will go away at what cost?
And here is a financial issue. Let's take a look in China. Last month, China, the world's largest automotive market, which now, by the way, is the largest market for General Motors, for Volkswagen, a number of companies. That's where they're getting the profits from these days, right? 90% down for the month. And this could go on for a long time. Now, the spillover effect is starting to be felt here. So, for example, factories officially, the air quotes, officially are back and up and running. Yeah, they get 20 to 30% of their workers in many of the factories. So what you're having is a trickle of parts where they might be knocking out 100 widgets an hour. They're knocking out 1 or 2, if they are at all. These are starting to cause shortages here in the United States. You're going to start seeing, from my experts, probably by the middle to late part of this month, you'll start seeing some factories that may run out of parts. Also, service and repair. Your car gets hit, you may find in some cases that repair parts are not available.
But we're also hearing from China, too, that the number of new cases is going down. That could be a good sign of what perhaps we could do in this country.
If we believe them.
If we believe we can trust them.
Assuming we take those precautions, then it's going to go down. But I think we're going to be in for the long haul here.
Could be. And this is not a communist country. We cannot order people around the way the Chinese.
What we do know is that we do have examples of successful countries.
Absolutely. All right, you've heard from the panel. Next, it's your turn when Charlie takes the show on the road.